From the past two webinars, we learned about how to work on ourselves. How can we deal with the stressors in the medical school in the process of the 5.5 years of continuous rigor. I will talk about how your environment, how the people around you, how mentors, how your peers can actually influence your journey in medical school, and how important is peer support and mentoring in medical students. So I'm Ashvin Kishore, third year MBBS student from Sri Ramachandra Institute in Chennai. So let's begin. One second. Yeah, okay. So let's start by understanding what exactly is peer support. Now, we all know that peer support may be academic, non-academic, and it is about how a group of people, a group of friends can come together and can teach and learn, can train together, can support each other, and can achieve a common goal. So in medical school, I'm sure all of us who have entered medical school have cleared the NEET exam and have entered first year MBBS, knowing and understanding the volume of the particular course. So I remember when I saw the volume of my anatomy books, my physiology textbook, and there's so much syllabus, there's so much to do, there's practicals, there's whatnot, there's studying of bones, and it's very overwhelming for a student. So in that situation, what one needs to understand is that every medical student, every person around you, 250 students in your batch are in the same boat. One must understand that, because that's how a peer support is established, by understanding that you're not the only one. So it involves the assistants and also a group discussion or helping out each other, maybe academic, maybe even non-academic. I'll come to that. So it can work as a channel in which people can learn and teach with each other and grow towards a common outcome, which is passing a test or just understanding a concept, or maybe can be many other things, such as extracurricular activities. You require support there as well. So it is definitely important when it comes to the life of a medical student. So what is peer-to-peer learning? Essentially, it is when you are not able to understand something yourself. I can definitely sit in my room and read the textbook, watch YouTube videos, and engage myself in active learning. But it's very important to know that when you teach somebody, you are actually finding out your own flaws, and you're trying to figure out where am I lacking in this particular concept. So I'm going to speak mainly academically, because that's why we're here today. So when you're teaching someone a concept, when you're engaging in peer-to-peer learning, you're learning from someone. Number one, you are trying to clear out your own concept. You're practicing yourself. If suppose I learn one particular topic and there's a huge chunk of syllabus we need to cover, but there is one particular topic which I study and few other topics which my friends may study. We can come together and talk about these topics and discuss what we have learned, what our perspectives regarding this is, and also understand everyone else's perspective. And perspective learning can be enhanced when you solve questions related to these particular topics which you study, be it first year anatomy, physio, or also in your clinical subjects, when you're trying to diagnose conditions, you're trying to come up with treatment options, and you're trying to extract information from textbooks and present it in an answer. It's something which will really enhance your overall and wholesome holistic learning. So what are the benefits? Let's come to the benefits of it. Students can see more to just textbooks when it comes to speaking among friends and teaching each other, and and can delve into the topics even more. When you actually enjoy studying the topic, when you're teaching, when you're learning from a friend, it's a more casual approach. It's not something which is didactic as a lecture, or something boring as watching a Marrow video or a YouTube video or anything like that. It's not just you in front of a interface trying to learn something and trying to imbibe it in your brain. It's actually you actively processing information and telling it to other people, and then other people processing that same information and giving you feedback. Now, feedback is an important word, because feedback actually helps you understand where you stand, and based on that, you can work on yourself. You can help others grow in that aspect of feedback. I'm sure there's always an aspect of where someone may lack in some subjects, some may lack in some particular topics, in some particular, maybe in exam giving strategies, in vivas. So that's when a peer comes in hand, and you can actually practice these skills and develop it over time. In a more casual approach, you can make mistakes here. It's very important to know that these platforms such as peer-to-peer learning is where you can make all the mistakes you can, because there should be such an environment that should be created in which there is a stress-free environment where you can be yourself and you can enhance and work on your learning and your skill building. So I'll one by one go with the benefits about what peer-to-peer learning encompasses. So firstly, academic assistance. Of course, like I mentioned, teaching, the more you teach, the more you learn. So suppose I'll give you an example. If I'm still teaching, the anatomy of eye in my first year, I'm really not understanding. I'm trying to really understand these microstructures and I'm not getting it in my head. I'll probably ask a friend and ask him, what all do you know about this? And similarly, if he has a problem, I'll try to tell what I may understand from this particular concept, and what he may understand from what he or she may understand from that particular concept. So together we combine and analyze and go through questions, go through the diagrams, various resources, and then we both come to a consensus in which, okay, both of us have learned and imbibed this topic properly. And another interesting fact when it comes to these peer-to-peer learning, something I came across, is that when you're actually attempting a question later on in your exams, you can actually, it stays in your brain, it's in your core memory. So it actually, you can transfer yourself back to the time where you were actually discussing these topics with your friends. So I'm sure many of you would have gone through this, especially like Khushi mentioned earlier. Before exams, you might study a topic or might discuss something, and that exact same thing might come in the exam, and then it clicks that, oh my God, I just discussed this with someone. It's really beneficial because it stays in your head for longer. So after that, diverse perspectives. Of course, when you're solving questions together, when you're preparing for exams together, there's a plethora of perspectives which may come in a particular approach to a question or an approach to a particular topic. It might be different for me, it might be different for you. So when a peer-to-peer group comes together and talks about discusses a particular topic, you may sometimes encounter different perspectives on a particular pathology, or maybe an added perspective to what you may not, and come across when you're solving that particular question. So that definitely is one of the important perspectives related to this. So apart from that, you have mentorship and guidance. So sometimes we may fail as medical students. It's a long process. We may not satisfy ourselves when it comes to our academic demands, and we need help of our peers at that time. It's only our teachers and our professors can only help us to a certain extent. It's our peers who will actually make us grow and make us come out of these things. So that's where mentorship and guidance really comes into play, because there are flaws in everyone. It's about coming across in a comfortable environment, in a healthy environment, and acknowledging the fact that I can grow in this environment under these particular friends who I have. And through these peer learning sessions, you can actually, come out of a lot of problems which you may have academically, or any weaknesses which you might have. You can strengthen those weaknesses because of your support of your friends. After that, you have enhanced communication skills, which is very, very important, as we're all going to be clinicians one day. Just sitting in my room for 5.5 years reading a book will not make me a good doctor. We all need to realize that studying as much as theory as possible will take us nowhere when it comes to the clinical side. So rather than me just studying theory, of course, that's one aspect to it. But if I can actually channelize my information and teach my friends, it's like explaining a patient his diagnosis. You're trying to simplify it. That's what I like to do. Whenever I like to explain anyone comes to me with a question, I like to simplify it and go back to the basics and understand what that person understands, what knows, how much his level of understanding is, then only bring in my inputs. Because that's the exact same thing you will be using with your patients in your clinical postings. I'm sure you've already come across those clinical posting sessions. And when you're in your entire life as a doctor, as a professional, you will be facing these scenarios. So communication skills is something which is very, very important now that EdCom has come into the NMC guidelines, which inculcated in our curriculum as well. They are putting more emphasis on these things. So definitely communication skills can be enhanced through this process. And like I said earlier, assessment and feedback, testing yourself, ask your friends questions. It's okay if you get them wrong. You really need to understand that it's okay if I'm in a comfortable environment. I can make as many mistakes as possible, but it's important, like the speaker said earlier, it's important to choose the right people who will not put you down. It's about choosing the right environment who will actually make sure that both of you uplift your skills and knowledge at the same time. So that's about the benefits. Now, I have told you a lot of these things. Where am I getting this information from? Of course, it has to be there's some research background to this. So I went through a few papers about how peer support can actually influence, the level of knowledge and the level of anxiety. How can it influence burnout? And like we spoke earlier in the previous sessions. So according to one journal, it definitely peer support can actually buffer feelings of inadequacy, anxiety, and isolation. Because, like I said, when I started, you must understand we're all in the same boat. Once we realize that, we'll definitely feel much at ease that, every medical student is going through the same thing I'm going. So it's better to talk about it to them because they will empathize with you. They will know exactly what you're feeling. And also face challenges such as anxiety of tests, like I mentioned earlier. Question yourself, keep that question answer going. And once you have done this bit, I'm sure when you give your real vivas, you'll be able to tackle those vivas very easily because you have practiced it multiple times with your friends. Even if it's a casual sitting, you can just ask that, I've studied this topic today. I'm just going to ask you a few questions from it. Let's see, it can be in a very fun way. Learning can be a very fun process. It can be very casual as well. And you can not underestimate the fact that a casual session of learning can help you enhance your knowledge by a greater extent. You may not know about it. So another thing is it reduces stigma about academic stress. Now, we all know that medical students are always stressed, but do medical students know how to cope with that stress? We don't know. That's why we're having the seminar. And peer-to-peer interaction can help in academic stress and students realizing that how can I deal with the stress effectively? Maybe my friend is doing it better than me. So it's about myself to look around, be aware, and apply those skills to myself, and work on my progress as well. Now, I talked about comfort already. It provides a comfortable avenue, a good environment to learn, and can also address mental health concerns because a lot of us are living in hostels, a lot of us are living away from home. So we need to understand that it is our peers who are our family in this hostel, and it is them who are responsible, who will be there for our mental health problems, because it's very, very prevalent among medical students because it is a long drawn process. It is a stressful process. There is work involved every single day when you come here. So you should normalize the feeling of uncertainty and sadness. Like I said earlier, everyone's in the same boat. That feeling of uncertainty will start when you're in the first year or the second year. You will feel, I'll quote, fear of missing out. That particular feeling is prevalent everywhere. That am I doing enough? That's the number one question medical students ask themselves is, am I doing enough? And that's something you can only know if you go out in the world and interact with others and learn about what other people are doing and what interests you, what things I'm not aware of. Maybe someone's doing something really great and I'm interested in that particular activity and I want to go ahead with that. So that can only happen by conversation and communication. So remember that isolation and studying textbooks will not take you very far in your medical journey. Let's move ahead. I'm going to talk about my own experience. So these are my friends who normally we go for a lot of conferences. In fact, we organized a conference with the Indian Medical Association at our college this year. So why am I talking about my personal experience? Because I want to give a personal touch to it and tell you how I have grown because of peer-to-peer support. So how did it start with me? When I came to the first year, we know that we have dissection classes, right? So that's me holding a human brain in my probably first dissection class. I'm being fascinated by, all of us were fascinated by, seeing these organs and coming to these cadavers and dissecting them. And I'm sure it's a wonderful experience hopefully wonderful experience for all of you as well. So during this process, I understood that I cannot just sit there and learn everything by myself. It's my peers who will actually give me perspectives, and they will teach me some certain things along with my professor, of course. But it is the peer-to-peer discussion which really enhance that discussion going on and can actually help me retain things in my brain. So that's how you start off. You start off by talking to your peers and understanding what they might know and what you might not know, and also sharing your experiences with the same. So that's something I did in my dissection classes, in my practical classes. And learning by teaching. There are a lot of webinars, a lot of seminars which come across in our college and other colleges as well. So it's important to interact and take part in these seminars, give talks. That's how you will also strengthen your own process of learning. Another thing very important which comes across is quizzes. Now, there are a lot of undergraduate conferences, like I mentioned here. There are many undergraduate, about 500 medical undergraduate conferences happen per year in the country. And many of us would love to take part in these colleges, be it in our city. I'm in Chennai, so being in Chennai, being in fact, Pondicherry, in Delhi, in many different cities, we keep going for these conferences, and we go as a unit. It's not just me or someone else going alone and attending these conferences, because that will not help. In fact, we go as a group. We apply for different workshops, we apply for different events, and we give feedback to each other that what have we learned here today, so that we get a more holistic approach of learning and we can take back home something really great. Participating in quizzes, I'll come to again. It's very important, just not for your peer-to-peer learning, but your own growth as well. When you talk about competitive exams such as NEET PG, now the next, USMLE, PLAB, all these, they have multiple choice questions involved in them. And our curriculum as of now doesn't emphasize much on multiple choice questions, which will probably come in the future. But for now, for me at least, we are more focused on writing answers. So quizzes is something of a platform which can really help you widen your thinking and can make you understand what are the expectations set in a particular quiz, and am I meeting those demands? Because a lot of these questions are actually taken for the entrance exams. That's what I have come across. I've given many quizzes. I have made it a point that whatever conference I go to, I would rather attempt to take part in that quiz if I qualify or not. But I do attempt it because it gives me a wider aspect and a horizon to what people might be learning in that particular college. So organizing conferences at my college similarly, and attending others. Now, another very important aspect is when you come to your clinical years after your second year, clinical postings is the best place to discuss, and it is the hub of peer-to-peer learning, if I may say. It is where you see a patient, where you examine, you take history, and you discuss a case. Now, let me ask you a question. I'm sure all of you in medical college know that when we go to a clinical posting, when we post it, we're divided into small groups of maybe 30 or maybe 50, and then we're posted in different departments at the same time. Why aren't we just go to the same as a lot of 200 go to the same particular posting? Of course, it's impractical, right? But one more important aspect is, because to enhance peer-to-peer learning, we are broken into small groups in which we can have individual conversation with each other and actually enhance our learning. So discussing cases and interacting, learning from others is of utmost importance. I'll give you my example. I'm a non-Tamil speaker who came to Chennai, and when I started my clinical posting, I was absolutely fearful of how I will tackle the situation of not speaking with patients when I don't know, the language. So that's when my friends helped me. The Tamil speakers, they came to me and they taught me the basics and how I can approach and overcome this fear of going ahead and talking in this language. And then later on, I picked it up, and now I can speak a bit. But it's because of them, it's because of my peers, that I was able to overcome this fear. And that's another aspect of peer-to-peer learning. Another thing is senior-junior interaction. That's another form of peer-to-peer learning. Of course, we always look up to seniors and what they're doing. We learn from them, not only what to do, but also not to do. So that kind of misunderstanding, that kind of haze can be cleared when you talk to your seniors, because they obviously have more experience than you. And of course, sharing the same with your juniors, it strengthens your bond. So that's about my personal experience. Talking about mentorship now. Now, I spoke about peer-to-peer learning and mentorship in that aspect, but let's talk about mentorship in general. Now, I'm sure a lot of Lord of the Rings fans, Harry Potter fans are here, so you can get this reference that Frodo had Gandalf, Harry had Dumbledore, and in case of Wizard of Oz, Dorothy had Glinda. So, and all these three people were wizards. So, in these stories, we can get to know that it is the mentor who is the wizard who magically can help you mold and grow into a better person. So it's about us. It's our onus about how we look up to our mentors, and we go forward and learn from them, because mentorship is something which is prevalent throughout medical school. Not only that, even after when you graduate from medical school. So what are the benefits of mentorship? It extends beyond medical school. It shapes a person in general. It can help you academically as well as non-academically, because there's a lot of advice which a mentor may look at you and know your strengths and weaknesses from their own experience. They can share their own personal gains and can tell you about where you lack and where you can make a better situation out of yourself in your medical college, be it academic or non-academic situations. And it helps you. And sometimes if you're just looking at your mentor work, If my mentor is suppose a medicine professor, I'm looking in how he examines a patient. Just by looking at him, not by speaking to him, just if I observe what he's doing, I can actually pick up a lot of things from there. And I speak to a lot of doctors, and they always quote their mentors all the time, saying that I learned this from this particular professor, this particular senior professor, this senior resident. That is how we will also be when we grow. And it starts from now. It starts from medical school. It's about observing and learning passively as well. And of course, serving as role models, they can help you build your confidence, because medical students have tendencies to have a little less self-confidence. So getting a mentor, doing a project with them, learning some extra topics with them, helping them in their work can actually build your own self-confidence that you are doing a good job. Now, what are the future of peer support? How can we take this forward? Now, in this picture, if you can see, I've shown a medical student learning from an intern learning from a postgraduate or a junior resident, and a resident learning from a professor. So the concept of mentoring stays lifelong. And we need to understand that we need to expand these peer support programs and make it official in our medical schools. We need to promote it more from the base itself, because if we have a good foundation, we'll be very streamlined in this particular process of learning as we go higher in the scale. And we should foster a culture of mentorship in our medical schools, and try to inculcate every student having a mentor. That's something that's happening in my college. We are assigned a mentor when we come into the college, and we regularly go and interact with that particular mentor and tell what anxiety and fears we may have, and share with them, share the good, share the bad, and they will give you their own experiences, and we can really help support the mental health and in this long drawn journey of medical school. As I always say, I always believe that medical school is not a sprint, it's a marathon. So just keep your stamina running, and it's just about the endurance which matters. It's about pulling through properly in a more streamlined fashion. So these are a lot of techniques which you can use to streamline your journey in medical school. So that's all from my side. Thank you so much for listening. And a quote to end is that when you learn, teach, and when you get, give, by Maya Angelou. If there are any questions, I'm open to any questions.